Back to my channel, Dr. SP. Today we are going to talk about part 2 of UPSC Combined Medical Studies Examination. The part 2 consists of 120 questions. We can divide into 3 subjects: PSM, Gynecology and Obstetrics, Surgery. Each subject carries 40 questions, that is PSM 40 questions, Gynecology and Obstetrics 40 questions, Surgery 40 questions. In each categories we can get 20 or more questions as direct questions, and the remaining questions as multiple choice with multiple right answers. So I have given here very important topics that you need to learn for this examination. For PSM part, vaccine and vaccine related national immunization schedule and health programs related to vaccination, 5 questions or more. Then health programs in India, 2 questions. Nutrition and health related topics, 5 questions. Occupational health, 1 or 2 questions. Epidemiology of communicable and non-communicable diseases, 2 or 3 questions. Demography and family planning including contraceptions, 2 or 5 questions. Screening for diseases, 2 questions. Calculation based type questions, 5 questions or maybe less. So for contraception and related topics, we have to correlate with gynecology and obstetrics. And nutrition and health, you need to study about nutrition, malnutrition, food adulteration, nutrition deficiency and diseases, 2 questions or more. For vaccine and vaccine related, including schemes and plans, you will get 5 questions or more. Concept of health disease, epidemiology. In epidemiology, you can get compulsory 1 question based on calculation. And demography also, you can get calculation type questions 1. Okay, here you can see I have given in details about calculation type questions. You have to study about rate and ratios, specificity, sensitivity, and epidemiologic studies, different types of epidemiologic studies and classifications related questions. You may get 5 questions and more. Okay. For gynecology and obstetrics, gynecology 20 questions and obstetrics 20 questions, and most of the questions are correlated. For example, in anatomy, you may get 1 or 2 questions, and infertility and sterility 2 questions or more. Gynecology diseases and cancers, and disease of vulva, vagina, uterus, fallopian tubes, ovaries, cervix and related type questions. You can get 10 questions or more. Okay. The most important topics, are given here. You can see the infertility and sterility and cancers related to gynecology, and gynecology diseases like pelvic inflammatory diseases, sexual transmitted diseases, tuberculosis of genital tract, and diseases of vulva, vagina, uterus, fallopian tubes, ovaries, cervix, and related questions. You can get 10 questions or more. The allocation of questions may be different, but you can you can compulsory get more and more questions based on these topics. And for obstetrics, you have study about maternal pelvis and related to maternal pelvis, example contracted pelvis, how do you manage, and pelvis classification, etc. And normal labor and management of complications that may arise during pregnancy, for example abortion, ectopic pregnancy, and other conditions. Evaluation of fetal and maternal health. So management of complication of pregnancy, you can get 5 questions or more, and evaluation of fetal and maternal health, you may get 1 question or 2 questions, and fetal malposition and malpresentations, you may get one question. Then antenatal, intrapartum, and postpartum related questions, you may get remaining 10 or more. And then surgery, you have to study trauma related to head, chest, abdomen. You may get 3 or more questions. Shock and resuscitation, you can get 2 or 3. And hernias, you may get compulsorily, you can get 3 questions. It may get we may get more, but not less than 3, especially in cases related to pediatrics. Then fractures, orthopedics 1, but GIT and surgical acute abdomen, you can get 10 questions. Okay, here is detail, you can see it. Okay, trauma related to head, chest, abdomen 3 questions, or you may get more. Shock and resuscitation 1 question, hernias 3, especially related to pediatrics 3 questions, and fractures 1 question, GIT 5 questions, surgical acute abdomen 5 questions. So totally the GIT and surgical acute abdomen, you may get 10 questions. And neck diseases related to neck, mammary gland, thyroid, you may get up to 10 questions less. You have to, these 3 topics are the most important topics you have to study in surgery. Neck, for example thyroglossal cyst, everything. And mammary gland, you have to study correlated with oncology, pathology, and surgical management. And wound healing and surgical site infections, you can get 1 or 2 questions, I think, or maybe you can get up to 5 questions. So the most important topics in surgery are diseases related to neck, mammary gland, thyroid, wound healing, surgical site infections, and sutures. Okay, that's it for today. I hope this video is helpful for everyone. Thank you.